The following 5 participants are in the conference.
Here we go. We're finding out about our local press.
Robert Hansen, KTOX.
Bill McMillan, Mohave Valley Daily News.
Today's News Herald.
Paul Lavoie, Radio Central News Network.
Good afternoon, everyone, and welcome to the press and our Mohave County residents as well for tuning in. I'm Roger Galloway. I'm the Mohave County Communications Director, and we're very fortunate to have the 4 CEOs of our area hospitals with us today, participating along with our Mohave County Health Director. Public Health Director is Denise Burley. And a lot's happened since we were last year talking on the subject, the same subject of COVID-19, and we're going to kind of bring things up to date and hear from the press with what questions they have and what they're hearing from their readers or their listeners as well. In a few minutes, I'll call on individuals from the media outlets to ask questions. I'll call on specific outlets first. Each of you can ask a question and then a follow-up. And then I'll ask others to simply come in and identify themselves. And when I call on you, just ask your question, and we'll go along like that. Please don't forget to mute your phones when you are not speaking. And I do have a couple of text questions as well. We'll turn to that in a little bit. We're going to turn to our Mohave County Health Director, Denise Burley. Denise will be making a statement first, but before we go to her, let me introduce our CEOs. They are on the screens far right, and they are Feliciano Hiron. He is the CEO of Valley View Medical Center. That's in Fort Mohave. There's next to him is Mike Patterson, CEO of Havasu Regional Medical Center. And then to his right is Michael Stenger, who is the CEO of Western Arizona Regional Medical Center. And finally, we have Brian Turney, who is a CEO of Kingman Regional Medical Center. Before we turn to Denise, do any of you like to make some kind of opening statement? Feel free. Who would like to say something? Yes, Mike from Havasu.
So I'll start it off, and just wanted to start with a few recognitions. First of all, a thank you to all of the businesses and community members out there who have really stepped up and donated items, especially personal protective equipment items, to the hospitals. There's been a huge outpouring, and just want to say thank you on our behalf to all of the businesses and community members for that. And also, we need to recognize all of the healthcare workers in our hospitals who are working, day and night right now, taking care of patients. It's a challenging time, as we know. We haven't even really hit a surge yet, but still is challenging for our staff, and we want to recognize all that they're doing. Thought I'd maybe just give a quick update on what we've experienced so far. We are seeing about 10% of the patients that we test who are coming up positive with COVID-19. In our hospital, that equates to 5 patients who have tested positive up to this point, and 3 of those patients are still in the hospital as we speak. We are also waiting for results still on about 20 patients, and we are seeing a little bit quicker turnaround in the last few days on getting tests back, usually within 24 to 48 hours now, so that is improving. So that's good news. We continue to screen all of the people who come into our hospital. Right now we have a no visitor policy, and so we're screening employees and physicians and patients as they come in. That will continue. And we are also, just making sure that our staff are wearing the appropriate personal protective equipment to be able to take care of any patient that might come into our hospital. It's also important to note, I think, that our 4 hospitals here are working very well together. We've been in communication with each other. We will continue to do so. We all acknowledge and have everybody here is willing to step up and help out anywhere we can and whoever we need to get through this COVID-19 pandemic. And then HRMC, Havasu Regional, is also working closely with our partners down in Parker as well with those hospitals. So then the last thing, I would just encourage people to still adhere to the governor and staying at home. Only go out when you absolutely need to. I think we just all need to continue to adhere to that until we get through the curve on this. So that's what I'd have to say for now.
All right, sir. Anyone else? Yes, Michael Stenger from...
What Mike Patterson just said.
Yes.
To thank not just the hospital workers, but also the nursing home workers, the home health and hospice workers, as well as those that work at the clinics, both private and hospital affiliated.
Oh, we got to turn your microphone back on.
I am so sorry, excuse me.
No problem.
So I'd like to echo what Mike Patterson just said, and also thank all the healthcare workers working in our nursing homes, home health and hospice, all of the clinics, both the private community-based clinics and those owned and operated by the hospitals. They're also working very hard to protect our community and their patients from the pandemic. So the last time we met, about a month ago, I got to tell you, we're a lot smarter and a lot more conversant about the COVID-19 pandemic than we were at that point in time. I can also assure you that the hospitals are much, much better prepared today than they were 3 weeks ago. A lot's happened. We've learned through experience where our strengths and weaknesses are. We've addressed the weaknesses as best we can at this point. We're still learning on the go. I will say that as prepared as we are, we do know that the potential for a surge is still out there. We know that Arizona apparently is projected to have a peak sometime in about 2-3 weeks. Maybe it's 2 weeks now. But we're as prepared as we're ever going to be. At this point, there aren't the fears that we used to have about having enough supplies. However, that can change. We have enough now. We're conserving, we're preaching conservation, not as a cost reduction strategy, but conserving a very precious commodity that we're going to need in spades if we get hit with a surge. And so we're reusing, reprocessing, and making sure we're not being wasteful. A lot of the products that we depend upon, not just PPE, but drugs and other medical devices, are no longer manufactured in the continental United States and actually come from Pacific Rim countries. We know that the supply chain globally and nationally has been disrupted. And just because we typically order on Mondays, Wednesdays, and Fridays, supplies, drugs, whatever it might be, you can't always count on that shipment coming in when it's supposed to, in the quantity that it was supposed to be delivered. So again, we're trying to conserve a very precious commodity because we know if we run out, we have no protection. So having said that, at Wormsey and Bullhead City, our situation's a little bit different. We've had 37 total tests that have been performed using the CDC guidelines. We've only had at this point 2 positives, one from an inpatient who was suspected of being positive and was treated as such, and another was an outpatient that came through our ED. So our conversion rate has been 5%, so it's actually half of what it is in Lake Havasu, which we're thankful for, but we know it's our time at some point in time. So with that, I'll just wait until we have some questions. Thank you.
All right, sir. Any of the other 2 gentlemen up there want to say something? Brian from
Yeah, sure.
Kingman.
As I shared at the last press conference, and I still feel this way, this is a team sport, and I appreciate the understanding of the community. With the restriction of visiting hours, I know emotionally that takes a toll. Mike Patterson's referred to the employees. We have about 2,000 employees total, and I'm proud of how our people have reacted. They are taking risks as they care for people, just like somebody that, the checker in the grocery store is taking some risks too, but in healthcare, there's some additional risks that people take, especially in certain situations, and I'm proud of them. And I just ask people to remember that the degree we can keep this from spreading, we reduce the risk not just among ourselves, but our healthcare workers. And these people are, our healthcare workers are mothers, fathers, brothers, sisters, sons, daughters, and sometimes I think we forget that. We consider them nurses or doctors, but they're people that struggle with the same things that we struggle with. So hopefully we can remember that. We've referred to the testing. At this point in time, I'm happy to share that we're getting our results back more rapidly. Last time, We were meeting, it was a 5 to 8 day wait to get results back. That's a long time in this situation. We're down to about 2 days, and or at this point in time, we think within a week or maybe a week and a half, we'll be down to 45 minutes because we're bringing that testing in-house. Despite what you've seen on the national news, there has been shortage of things like reagents and swabs and those types of things, and we're starting to make some progress with that. So we're excited to be able to do even more testing moving forward. But right now, we've done 273 tests in our community, 243 results. We've had 7 positives at this point. That's roughly a little under 3% in our community that's coming back positive. Statewide, I think it's around 7%. But we're starting to see the numbers tick up, not just in our community, but it looks like around the county as well. So people do need to continue to pay attention to this, because I think the experts believe, like say towards the end of April is when we're going to see the biggest part of that curve, and hopefully we can limit how tall that gets, and so people aren't as at risk by virtue of practicing things like social distancing. So I think with that, I'll just leave it there.
All right, sir. All right. We sent out a press release just a short while ago on our 22nd case, our 22nd positive case in the county. There are some places, it's kind of a big thing that's out there right now and being talked about. It's being reported it's actually our 23rd case. So I know that's going to be part of your statement, Denise, as we turn to Denise Burley, who is our Mohave County Public Health Director. Denise.
Good afternoon, and thank you. I recognize there's some challenges with the numbering, but I wanted to sort of explain how we get to our case numbers. And basically, you know, in a nutshell, what I can tell you is that if an individual provides a primary address, physical address that is in Mohave County, that case becomes ours as a county. So in one particular instance, the person was in Arizona, in Mohave County, in a hospital. However, the physical address that that person presented to the hospital was a California address. So in that case, that county that that person resides in, that becomes their case number. So when you look at cases on our website, that's how we base our case count. It's about our cases only. While there may be other individuals in our community with COVID-19, hospitalized or isolated, they may not be our case. And I can't give an example of another case where we have that yet, but I do know that that is something that can occur. And it works both ways. If we have an Arizona resident in a different state and they learn that they're COVID positive, that county would then contact us.
All right.
But it would become our case.
All right. Anything else in your opening statement?
No.
All right. All right, we're going to turn to questions from the press right now, and I'll call on some individual outlets to begin with, and then after that, you'll each have a question and then a follow-up, and then after that takes place, then you can just kind of state your name and the outlet, and I'll recognize you, and you'll go with your question. All right, let's turn, because I know they have some questions, to the Lake Havasu Herald.
This is Michael Zog. I'm wondering, I guess, we've been hearing about, with shortage of testing, that patients, or in other hospitals, there's been an influx of patients that aren't confirmed cases, but are experiencing respiratory issues. Can you just kind of give us an idea what the situation is in the local hospitals here?
I think if your question is what are we doing as far as testing and who we're testing, in our hospital, and it's probably the same in all of them, we are testing anybody that shows any signs that they might potentially have COVID. So respiratory disease, shortness of breath, and fever, or those kinds of things. So if a patient presents with those symptoms, we are testing them.
You have a follow-up?
Yeah, I guess when we talked a couple weeks ago, you talked about how capacity was down, bed bed capacity, beds were available. Can you just kind of give us an update on where you guys are at as far as bed capacity?
Yeah, in Havasu, it's unchanged, or we're still down considerably from what we would normally run at this time of year as far as number of patients in the hospital. And then when you look at our emergency room visits, our outpatient visits, ER visits right now are down about 40% compared to prior year, and outpatient visits are down almost 50%. So we're right now we are down significantly in almost all areas.
Yeah, and Kingman, likewise, it's not as quite as high. We're running about, when we look at it from a revenue standpoint, we're down about 30% right now as a result of this, with the elective surgeries, elective procedures being delayed. And our inpatient, I think that's down as well. So across the board, we're finding it down, and it's been a significant financial hit. I just got off a phone call. It was a statewide call with Arizona Hospital Association. This is pretty much issue statewide. So hospitals are being strained financially significantly as a result of this issue.
So the good news is there's plenty of capacity at this point in time. We've not seen the surge. At that point, it could change, but right now we've got plenty of capacity, including open beds and staff to take care of those patients.
All right. We have from the Kingman Miner, from Aga at the Kingman Miner. She submitted this via text. Is mass testing coming anytime soon to Mohave County? Denise?
I think at this point we are still seeing a shortage of testing supplies, and I know that they are working on increasing that capacity and ensuring that we can, provide that at a higher rate, a higher level. But at this point, we still continue to see shortages. If you have any.
All right. Is the county trying to get coronavirus immunity blood tests that would identify who already had coronavirus?
I don't know what the county's doing, but we're looking at it as an institution. It's a serology test that in essence can take a look if people have been exposed or had COVID by looking at the antibodies. And we are having discussions about that. It looks like that test is going to be available in a few weeks. My pathologist team is taking a look at how we might implement that. I think that's going to be a valuable tool as some of the social restrictions are lifted. That might be a responsible way to maybe even to do that safely and maybe even early if you have good testing, both so if you can see how a population has been exposed to a particular illness, that risk levels is going to change depending on how much that's been in your community. So if you had testing both for current cases as well as people who have had that, you might be able to implement or lift the restrictions sooner, and I think that would be a responsible way to do that. So we've already started looking at that as an institution, and I'll probably be talking to Denise more in the future about maybe how we can do that countywide. We'll see.
All right. Finally here, a text question. If there is an increase in the number of positive cases, is it because more testing is being done?
Well, I do believe that could be a result of more testing, which is something that we would all like to be engaged in and pursuing. But I think the positivity rate overall is going to remain fairly consistent among our communities and statewide. So, which sits at about 7 to 10% basically at this point in time.
Right. Let's turn to Mohave Daily News. There's someone there.
Yes, Bill McNaughton. How are the patients being tracked as far as who they've had contact with? We've only had one case where there was any background on the actual patient's whereabouts. Is that being done on an individual basis, or?
I can certainly chime in here. The county follows up with all cases, and by that I mean that we contact the patient and we interview them about who they've been in close contact with, and then we follow up with all of those individuals and give them some guidance on monitoring symptoms and what to do in case they start seeing symptoms. But we follow up at this point with all of the positive cases and all of those contacts of those positive cases, all of those close contacts of those positive cases.
All right, sir, you have a follow-up?
No, that's fine.
Bill?
No.
Let's turn to Radio Central.
Yeah, thanks, Roger. Paul Lavoie, Radio Central News Network. Denise, we keep seeing press releases that say Lake Havasu service area, and are you referring to the area that the supervisors represent, or is that Yucca? Part of Topak? What encompasses that area?
Certainly, and thank you for asking that question. There does need to be some clarification on that. What we're referring to basically is a service area for, mostly so for a hospital, for example. So as far as Havasu Regional Medical Center and what their service area is there. So it's not by supervisor district. We were just trying to create an area that would represent that hospital or that region of the county to be able to capture those numbers.
All right.
Okay, speaking of county regions, the northernmost portion of the county, Beaver Dam, Littlefield, Colorado City, who do those people report to, and are there any positive cases from that part of the county?
At this point, we have no positive cases from that area of the county, and they would report to Mohave County Department of Public Health.
Okay, I have a question for you later, but I'll let the next person.
All right.
Go ahead.
Dave Hawkins, are you on? All right. We'll just open it up now to individual questions from those that I have not called on yet. Is there anyone out there that would like to ask a question?
Robert Hanson, KTOX, Niels.
Go ahead.
Okay, with the large disparity in the number of cases between Bullhead City, Kingman, and Lake Havasu, is anybody looking into the reason why there is fewer cases in Bullhead City than, say, Lake Havasu?
I think as we're seeing the numbers grow in the Lake Havasu City area, I think there is going to be more exploration of why that is the case, and I don't have an explanation for it at the moment, but I think that is something that we will be looking into.
You have a follow-up?
No, thank you very much.
All right, thank you. All right, someone else? Could be from any outlet at all. Okay.
Yeah, Roger, Paul Lavoie, Radio Central News.
Okay, Paul.
Well, we have on our PNTR Facebook page, I have a question from a follower. How can I get tested for COVID-19 antibodies? A lab in Scottsdale has begun doing it.
Anyone want to answer that?
I'm guessing that person wants to give plasma.
Yeah, I mean, at this point, there's some people that say they have that ability. I mean, that test does have to be approved. We're working with Mayo Clinic, with Kingman Regional Medical Center, and my understanding is it's going to be a couple weeks before we have that available. In essence, what that will tell you is if you had the disease, and it won't tell. It's not telling you that it's active. So, I mean, really the big value of that is going to be, well, a couple things, but the big thing is finding out how much of your community has been exposed, what risks are you going to have moving forward if you open things up. Clearly, they can use the plasma, I mean, down the road as far as, I mean, there's been discussion being able to use that plasma to help strengthen immunity with people in the future, but at this point in time, I don't think that technology's really been implemented, and I think they're talking possibly doing that in the fall time is what I've read. I'm not an expert about this, but that's my knowledge of it.
So my follow-up would be, with two big blood drives in the Lake Havasu City area tomorrow and Thursday, the community blood drive, would Vitalant be a good source for that information as far as testing goes? Do you know if the blood banks have a head start on it maybe?
I don't know. Like I say, my awareness as far as the testing being available right now, my understanding is it's several weeks away, so I don't know if you guys have heard anything different. So
no, nothing different.
Pretty much the same thing.
We have a text question here. Will the time, date, place of community places that were visited by people that are positive, will that ever be released to the public?
I think it depends on the circumstances, honestly, because if we look at our areas already having community spread, you could basically look everywhere and believe that it is around you. So when we investigate the cases and we work with those close contacts, that spreads out a lot. And we continue to work with those individuals that may have been close, but around those other close contacts. But it's a very, that you have to keep your circle somewhat close there. And so it really becomes about the patient and their close contacts. And I think in cases where we had, for example, the library, where we knew somebody had gone to the library and was positive, we wanted to make sure that the public was informed. And we wanted to make sure that people could monitor for symptoms again, because that's really what we're looking for from the public.
If that surge comes that was talked about, is there a particular ballpark number that you will look at and say, hey, it's going to start to happen? Is there a sign that will take place?
It starts with cases in your community, and then after that, typically, it's a couple-week lag between when the cases start to show up on an outpatient basis, and then they start to show up on the inpatient basis, based on all the modeling I've seen in the state. So when they're talking the projections, for example, they're projecting right now in Arizona the increase in outpatient cases to go up in April and peak towards the end of April, and then you will have a week and a half to 2 week lag with your hospitalizations. Now, are those projections right? We don't know. We're relying on people that obviously do that for a living. We don't, but so we have to rely on those experts. But that's the time frame we're looking at right now, based on what's being shared with us as hospitals.
A sure sign would be a rapid increase in activity through the emergency department, all 4 hospitals, because that means people are afraid now that they've contracted the virus, are symptomatic, and are feeling badly and have the symptoms and signs that COVID-19 patients have. And right now our ED volumes are approximately half of what they typically are for this time of the year. But once they get up to 100 to 120% of what we're expected, at that point I think we will start seeing a surge in positives, is my guess.
Back to the Herald. Is there another reporter there that has a question?
Yeah, I guess I'm wondering if we could get your thoughts on sort of the demographics we've seen. Obviously, a lot of the cases have been 18 to 49-year-olds, kind of younger skewed than in other areas, and we've had no cases in children yet. What can you guys kind of take away from that?
I think we were somewhat surprised by the demographics of the number of younger people that are being infected, and that is something of a message, I suppose, to those younger individuals that this is a serious disease and should be taken seriously in that light, and we want to prevent it, and they may be around their family members, their older parents, and that's where there becomes a greater risk of transmission with people who might be in a more high-risk population.
All right.
Some of the data that's coming out of New Orleans right now, in particular with the younger age groups, some of the modeling indicates that Some of the younger population is continuing to try to go through normal life processes that are occurring, even though they're being asked to stay home, and some are at home. They are still going out and venturing into the community, and that's been one of the major issues that continues to be a major impact for that age group. And I think there's a lot of confirmation by some of the government officials in these states, and in particular these areas that are most affected, like Florida, where you have folks that are going out and continuing to live their lives publicly. They're asking them to stay home, and it's mainly in those age groups that they're having to really focus that energy on.
Thank you. Anyone else?
Yeah, Roger. This question's for Denise. Paul Lavoie, Radio Central News. County Supervisor Ron Gould at yesterday's meeting strongly recommended residents wear a mask in public. Is that something you would recommend as well, or go on record as saying?
Yes, so there's a caveat to that. The CDC did on last Friday, change their position on that and are recommending that people wear cloth masks because we need to reserve N95 and procedural masks for medical professionals and those that are working in communal health settings and settings. So I do recognize that there are a couple of community groups throughout the county who have been actually making those types of masks, and I think that's a commendable activity, and I hope they continue to do so. But yes, I do suggest, based on CDC's new recommendations, that people wear a mask of some sort, of cloth mask, a bandana, or something to cover up their face to move forward. But I really want to caution against looking for procedural or N95 masks for that purpose, for the general public. We need to reserve those, highly reserve those for our medical professionals and those that work with our more vulnerable populations. And that also is for EMS, fire, police, our emergency responders. They also need that real PPE, that personal protective equipment. So we're trying to conserve where we can and trying to work with our partners to procure more of those items. But until then, we really need to secure those for our emergency responders and people in healthcare.
All right.
Is that the same that you would say for gloves then too? If people wanted to protect their hands from, coming in contact with the virus, say at gas pumps?
You know, and you all can chime in. So my feeling on gloves is that the goal is to prevent touching your face. So gloves don't necessarily do that for you because you're touching surfaces with that glove. So to presume that your hands are clean after touching something and then touching your face, I think would be problematic for people. So
One of the things that we heard yesterday from an epidemiologist who was giving a lecture that we had logged into online is that the actual cellular structure, there's two membranes, and nothing that soap and hand sanitizer will break through that membrane. So the best thing you could be doing right now is a lot of washing with plenty of soap, and sanitizer is probably the best thing you could be doing for yourself, and not touching your face, eyes, lips, anything that would allow that direct contact to introduce the virus into your body. But a lot of hand washing with soap, and again, that's going to help.
Has left the conference.
All right. Here's a question from the miner. We hear about people hanging out in groups in the Lake Havasu area vacationing. Will the county be able to do anything about it?
I think when it comes to enforcement of the governor's executive order, that unfortunately tends to fall to law enforcement, sheriff's department. I mean, we can certainly encourage, recommend, stress the importance of physical distancing, social distancing, but we really rely on the public to actually to do that and to take those necessary steps. So, we would love law enforcement not to be involved in these kinds of activities. I'm sure they have other things they would like to focus their attention on. But ultimately, when it comes to enforcement of the governor's executive order, that does fall to our law enforcement partners.
All right. we have any questions remaining from the press?
Yeah, relatedly, this is Brandon in Havasu. We've been following the stories of the crowds at the lakes here, and there are some calls to close the lakes, but there are a lot of people who think that boating is something you can do and still practice social distancing. Just wondered what the recommendation is from your perspective. Is boating and gathering lakeside something that can be done in a responsible way?
You know, a very good question, and we've left it up to really the local leaders of each of the communities to determine how to enforce the governor's executive order, because they know their communities best, and that's why we've gone that route. I think, you know, ultimately there are different sizes of boats, and your ability to social distance on a boat might be based on the size of that vessel and whether or not you're in a car to get to that site, and a number of other factors that play into actually getting yourself there and on the water. So,
Any other questions? All right, we'd like to see if any of our hospital CEOs, any of you, would like to make a final statement before we finalize everything with Denise Burley. Any of you? Please feel free to step in if you do.
Just like to say, please trust your local hospital and clinic folks. We're doing the best we can. We have a game plan. We're following the game plan. Stay calm, be smart, be vigilant, and please do not panic, because we're prepared for this. Thanks.
Thank you.
Ask that we continue to support all of the physicians, healthcare providers, and others that are out in the community. They are working diligently to protect everyone and to continue to provide care. Again, that reassurance, and to echo what Mike just mentioned, again, please look to us for that education. It's important that you go to the CDC and to the County Department of Health to gather your information. This is probably the best place to have the truest, most accurate information in regard to the COVID-19 components that are out in the community. And again, we want to thank all those people that are out there working with us, and the continued partnership of the 4 facilities that are sitting here today.
All right. Thank you. Denise?
yes, I think, you know, it's very, we want to remain calm, I think, is the main message out here, but we need to, as Mike stated, be vigilant on this as well. And social distancing, also known as physical distancing, is really a critical component of that, and we need the public's health in acting in that way. So if we could implore upon people to avoid the groups of less than 10, keep your space, take the necessary precautions of washing your hands, using hand sanitizer, wiping down those surfaces and things of that nature. I think that's the biggest message that we can send.
All right. Thank you. I want to thank all of our hospital area CEOs for being here today. Thank all of you for tuning in, the press for asking your questions, Denise Burley, who's been working at it very, very hard. Difficult times, but we're all in this together. You know, as they say, alone, but together in some cases. Don't forget that. Thank you very much.
Bill McMillan, Mohave Valley Daily